introduction. I want to just give you a little bit of context to the US healthcare markets, and I'm here to speak a little bit about what the healthcare environment and technology in healthcare looks like in the United States. Some basic facts. The United States, unlike most OECD countries, is a public-private healthcare market. Most people get their insurance through their employers. There's a certain premium that's taken out of their paychecks, and the employers enter a contract with commercial insurance firms. I don't know how many of you know this, but US healthcare per capita costs are the highest in the world. It's about $10,500 per capita, and the OECD average is about $3,200. Does anyone here know what the number 2 country is? Norway? The answer I had was Switzerland, but you could be wrong. You could be wrong, or I could be wrong. But the fact is that the US is almost twice as high as the next nearest country. The important thing to note about that is that healthcare outcomes are not necessarily much better in the United States despite the higher healthcare costs. The healthcare sector is highly fragmented. There's over 5,500 hospitals in the country. Many of them are small, rural, and community hospitals that are struggling financially. Those of you who follow a little bit of the policy environment in the United States will know that there is some amount of uncertainty in US healthcare policy. The future of the individual exchange markets, the future of funding for entitlement programs such as Medicare and Medicaid funding is a little bit uncertain. Now, the good news is that healthcare IT spend is growing. And the highest focus areas for healthcare IT spend today in the United States are data, analytics, and digital health. The Big Unlock is the name of the book Philip referred to. The book talks about unlocking insights from data and driving the digital transformation of healthcare. We are on the cusp of a massive opportunity to really transform healthcare, to improve healthcare outcomes, and to reduce healthcare costs in the United States. And the book talks about that. So what are the forces driving this big unlock of insights from data through analytics? There are 2 kinds of forces. There are market forces and there are technology-driven forces. I'm going to talk very briefly about some of them. The traditional model of healthcare compensation in the United States is known as a fee-for-service model. Very simply put, if a patient comes to a hospital and goes through and has a blood test, an MRI, a knee replacement, whatever, there is a price that is negotiated between the hospital and a corresponding insurance company, and the hospital simply bills the insurance company and gets paid for it. The patient doesn't even know, in most cases, what he or she is paid or her insurance company is paid. So there was an incentive to maximize volumes because that's where the revenues and profits were. But now all that is shifting towards what is now known as the value-based care era. And value-based care simply means accountability. The accountability comes with obviously two implications. One, if healthcare outcomes are not as expected, there are penalties. However, if healthcare outcomes are meeting expectations and exceeding expectations, there are incentives to be made. So there's a strong motivation for the healthcare sector to shift towards value-based care. And this is where insurance companies and the government are headed. Population health management is a natural corollary to the shift towards value-based care. So instead of looking at patients one at a time, you now look at patients in terms of an entire population. You use advanced analytical methods to stratify your patient population to predict the ones that are likely to face disease progression, the ones that are likely to have an acute care situation or a chronic condition, and focus on that. So you make better use of your resources and you're getting more efficient while improving healthcare outcomes. That's the concept behind population health management. Healthcare consumerism is also rising. And the main reason for that is that a lot of the healthcare costs are now shifting towards consumers. In a fee-based, in a fee-for-service model, the healthcare consumer, as I said, didn't really know what they were paying. The healthcare was being provided by somebody, paid for by somebody else, namely the insurance company, and consumed by the consumer. But now with the shift towards value-based care, overall responsibility, financial responsibility, is now getting divided up a little bit more between payers, providers, and consumers. So consumers may be facing slight increases in premiums. They may have to look at higher out-of-pocket costs, such as co-pays and deductibles. And all that is forcing consumers now to look at shopping for healthcare. And that's an alien concept in the United States, but consumers have to do that. Same time, consumers are also now beginning to have higher expectations. Digital transformation and digital health is obviously a consequence of that from a technology standpoint. We've looked at a lot of other things, data sources, IoT, genomics, social determinants, and so on. We'll be discussing that a little more in the panel discussion. Other technology forces that are driving this change: cloud computing, cognitive and AI, and blockchain. And if you thought all that was going to be easy, no, there are going to be some challenges. Enterprise readiness for new technologies is not what we would like it to be. Healthcare has always been a laggard in the adoption of technology in the United States. Security and privacy are big concerns. HIPAA, for some of you who are familiar with it, compliance with data privacy laws is a huge issue. Ransomware, cyber attackers holding hospitals to ransom for ransom payments. Data quality, data interoperability, this is a big thing. If you've got to unlock insights from data, you've got to make the systems work together. That's work in progress, it's not there yet. I'm going to just leave you with a quote from the CIO of Cleveland Clinic, Ed Marks. And the quote is, "We're at the cusp of an unprecedented opportunity to transform healthcare by unlocking data and using advanced analytics. Whether we're going to get there, I have no doubt that we will. There are some challenges, and there are fantastic opportunities ahead of us. And I look forward to the discussion with my esteemed colleagues in the panel discussion. Thank you."
Thank you very much for this very interesting talk, very insightful. So we'll have the discussion at the end of the four talks. So it's my pleasure to now introduce Guy Stein, co-founder